Get started. Hello, everyone, and welcome to our webinar on careers. And we want to thank, as we get started, we want to thank our Ohio College Tech Prep organization for partnering with us to produce this series of webinars. I'm Cassie Barlow, and I'm the president of the Strategic Ohio Council for Higher Education. And we are very lucky to have with us today Laura Willis, who is a nurse practitioner, and she works for Mercy Health. So Laura, welcome and thank you for being with us.
Absolutely. Thank you so much for having me.
Our pleasure. We're going to dive in and we're going to ask Laura some questions about her career so we can all learn a little bit more about the nurse practitioner field. So let's go ahead and get started. Tell us a little bit about what is a nurse practitioner, and how does it relate to your company's success? And while you're doing that, if you can talk us through the continuum of nursing, starting with, the person who's got the 2-year degree or the certification, all the way up to nurse practitioner. So if you can talk to us a little bit about that, talk to us about the pathway.
Absolutely, I'd be happy to. So I am a family nurse practitioner. There are several kinds of nurse practitioners. There are adult nurse practitioners, psychiatric mental health nurse practitioners. I am a family nurse practitioner, meaning I can see patients from the time they're born until the time that they're leaving the earth. And what I do that relates to the success of my company, which is a healthcare system, is that I see patients in a primary care setting. So a typical daily office visit where you would go for your routine healthcare or for a sick visit if you've, got a sinus infection, a cold. I can see patients, like I said, from birth to death and every age in between. But to touch on what is the continuum of nursing, it's interesting that you asked that question. I actually started as a licensed practical nurse. So that is a 1-year to 2-year program. It's sort of the beginning of nursing. I started doing that many, many years ago. Realized that I wanted to do more in nursing. So I went back and became a nurse prepared with an associate degree, which is a 2-year degree. Became a registered nurse at that point and moved into from more community-based like nursing home care into a hospital care setting. Lots of registered nurses work in hospitals, work in home care, that sort of thing. After that, I went and got a bachelor's degree. So a lot of programs now are either a 2-year or a 4-year degree. So you can either start with an associate degree as a registered nurse or with a bachelor's degree. The core learning is the same. A bachelor's degree program prepares people slightly differently, looking at theory and research and how that impacts and informs our practice as nurses. Nurse practitioners need, at the minimum, a master's degree, which would be another 2 to 4 years, depending on how fast you do it, of education. And there are many, many programs out there that offer, like I said, the wide variety of preparation for whatever kind of nurse practitioner people want to become. And then finally, there is a doctor of nursing practice or a PhD in nursing. I went back and got a DNP. So that is a degree that, it's the highest degree in the field of nursing. So it's the next logical step after a master's. If people choose not to do the DNP route, they can look at a PhD program, which is usually more heavy based in research. My doctorate was more practice focused. So there's a wide variety of education out there, a wide list of opportunities for people that want to be a nurse practitioner. You don't have to focus on family, you can focus on pediatrics, just on adults. Like I said, there are lots of opportunities for for lots of different things.
Awesome. Awesome. So a lot of opportunity, and obviously the company doesn't operate without enough nurses. We know that for sure.
Yep.
So this is going to be a funny one because every day is probably a little bit different, but tell us about a typical day, if you have a typical day.
Well, a typical day is anything but typical. That's a great way to look at it. So usually for a nurse practitioner in a primary care setting, in a typical doctor's office, if you will, we see patients essentially from 8 to 5 with a break for lunch sometimes. Usually see people in either, 15 or 30-minute appointment slots, depending on the reason that someone's coming in, and can see people for routine health visits. So they're coming in for their annual physical or their annual labs, or someone who's coming in because they're sick, most recently with COVID or the flu. Can be someone bringing their baby in for their 6-month checkup. It could be somebody coming for an exam after they've been in the hospital. So to transition back to taking care of themselves at home. So there's not necessarily a typical day, but there are, it's yes, it's typically atypical. It's just it's a very fun thing to do because really no 2 days are exactly the same.
Which makes for fun. I agree with you. Some people don't like that, but I do. So I'm with you. So how long have you been working for Mercy Health, and how long have you been in the field in general?
So I joined Mercy in the spring of 2015. So I think I'm coming up on year 8.
Okay.
And have done a variety of things with Mercy. I started in a typical primary care office and was able to transition for a period of time into an administrative role, and recently transitioned back to primary care. I've been a nurse since, well, I don't really want to say because it's been a long time.
It's been a while.
I have been a nurse for more than 30 years.
Fantastic.
I have been a nurse practitioner for almost 10.
Awesome. Awesome. Well, you have chosen an amazing field that is very much needed in our world, and I appreciate it. So
Great.
thank you.
Thank you.
So what is that thing? What is that one thing that gets you up out of bed every day and gets you into the office? What's that one thing that you really love about your job?
Wow. One thing. I'm not sure I can come up with just one. Nursing has been absolutely probably one of the best things that I've ever done. It allowed me, when my children were small, to have a really flexible schedule.
Yeah.
I worked weekends, so I was home during the week and was able to take my kids to school and be there when they got home. It has allowed me to grow and change and evolve as my life has changed.
Mm-hmm.
So I went from working night shift on the weekends with small kids to being a daytime nursing professor when my kids were bigger. And as I did that, the desire to be a nurse practitioner happened, and I've been able to do that. But truly, my husband and I were actually talking about this the other day. I get out of my car in the morning and walk up to the building that my clinic is in, and I am just so incredibly grateful every day that I have the opportunity to help someone feel better or help someone take a step toward realizing a goal that they have for their health. I am truly fortunate to be with people at their very worst and their very best and everything in between. It's an honor to be invited into someone's life that way. And I get to do it every day of my life. It's just a wonderful career.
Awesome. Awesome. Well, you just gave me the chills. You really did. So this is probably an all-day thing. You're never really working on your own, other than maybe when you're transcribing notes, right? You're typically working with other people in groups, with a patient.
So true. When I'm with a patient, I'm either, I'm either with that individual or I'm working with my medical assistant. I do spend a certain amount of time each week attending meetings in this Zoom format. We do a lot of work virtually, especially since 2020. We
Mhm.
figured out not only is it safer in terms of the global pandemic that we had, but it's also more efficient. We don't have to drive places. We don't have to sit in traffic. We can just hop on and communicate with people from all over the health
Mhm.
system. So there are things that I do that don't involve direct patient care. And so probably 3 or 4 hours a week, I spend time either meeting with other people live and in person or virtually, but typically 8 hours a day is patient care or something related to patient care, like writing my notes or looking at my messages or
Mhm.
processing medication refills, looking at labs, that sort of thing. So
Okay.
it's for sure 8 hours a day taking care of patients, and the other part of the day is doing things like this.
Right. Absolutely. So what is the biggest challenge, would you say, with your job?
Wow. Um, Having time to get everything done
Yeah.
and being able to walk away right when the day is quote unquote over.
Mhm.
Um, Nursing in general is probably more than a full-time job. Being a nurse practitioner feels like it's a 7 days a week job because there are always messages. There's always a medication refill to process. There's always a question from a patient who doesn't understand a test result or, has a concern.
Mhm.
So the challenge is really finding balance with all of the things that work requires and all of the things that life would like to have. And
Mhm.
it's definitely a balance. It's a give and take. Some days I am way better at it than others, and some days work wins, some days it doesn't.
I hear you. I totally hear you on that one. And it sounds like your work environment is mainly office environment.
Yep, a typical office where people would go for an appointment.
Mhm.
Yeah.
Okay. Are you expected to be on call in your current position?
So I personally am not on call, just by nature of the clinic that I work in.
Mhm.
But in a previous clinic where I worked, previous office, I did have call. So there are a couple of ways that that can happen for nurse practitioners who work in primary care. Um, One model is you take your own call. So any patient that you see, if they call you, it's 2 in the morning, 2 in the afternoon on a Sunday, you answer that call and respond. The
Mhm.
other model is you join with all of the other primary care providers in your group and you share that call. And that's
Ah,
what we did when I had call time. I was on call
okay.
for a week every couple of months, and we took call from the time the office is closed until 8 o'clock the next morning when they opened, and then for 24 hours on the weekends.
Okay.
And we didn't get too many calls, but the ones we did, they were important.
Absolutely. And people are glad that you're there, that you're able to be reached on a weekend or in the evening.
Yeah.
So you talked a little bit about this, your education and experience, starting with a 2-year degree, moving to a 4-year degree, and then the advanced degree to get to nurse practitioner. Um, and it sounds like there's opportunity to move to another level at the doctorate level.
Mhm. Yeah.
Okay.
So, anyone who wants to become a nurse practitioner must have a master's degree in the
Mhm.
state of Ohio. Um, the next step after that, if someone wants to get the terminal degree in nursing, is a doctorate of nursing practice or a PhD. They are not currently a required degree to work as a nurse practitioner, but the master's degree is.
Okay. All right. So it sounds like when you're looking for a new nurse practitioner, obviously require a master's degree.
Absolutely.
Okay. What is that skill when you are hiring somebody new, a new nurse in your office? What is that skill that you're looking for, other than obviously all the technical skills? What
Right.
is that skill?
So if we were looking for a new nurse practitioner to join the office, we would want it to be somebody that was willing to work as part of a team.
Mhm.
Somebody who understands that this is not a job that you can just turn off right at 5 p.m. It does come home with you. You have charts that you have to finish. We have to document, or just like in nursing in a hospital, if you don't document it, it wasn't done. And as a provider, if you don't document it, you don't get paid. So in order for the health system to remain functional, we have to be able to collect fees for the services we provide. So to do that, you have to close your charts. And some days those charts come home with you because you just don't have time to get them done. So
Right.
we would look for somebody that would, that understands that's willing to take on that responsibility. There are things we look for in new employees that I don't know if you would describe them as a skill, but you have to mesh. It
Yeah.
has to be somebody that you think you can work with, because we
Right.
spend more time with each other than we do with our families a lot of the
Mhm.
time.
Yeah.
We're spending that most of our time at work each week. So
Good
we want it
fit.
to be people
Good
that
fit.
we fit with. Yeah,
Mhm.
absolutely.
Yeah. Awesome. Awesome. So let's see. If you had the opportunity to talk with a young person about your career, what kind of advice would you give them?
100% be a nurse. It is wonderful. It's life-changing. It is truly, it's a calling though. So if you start into a nursing program and you realize it is not for you, it's okay to not have it be for you. It
Mhm.
isn't something that everyone can do or should do. So if someone realizes it's just not fitting well, I encourage them to take a step back and find something that fits better. For
Mhm.
somebody that wants to be a nurse practitioner, one of the things that I can share that I think is it's probably a little bit of a controversial piece of advice, but don't go right from a bachelor's program straight into a master's program and become a nurse practitioner. You need some experience. Go work in a hospital, work in the ICU, work on a med surg floor, get some experience with time management, with critical thinking, with prioritizing patient needs. It will do nothing but serve you better when you go
Mhm.
back to get that advanced degree. It will make you a better nurse practitioner. It will make you more marketable, all other things being equal. It may come down to who's had nursing experience and who hasn't, if everything else is the same.
That is really great advice. That practical experience before diving in, incredibly important. What about if you had the opportunity to talk with a teacher or a guidance counselor? What would you say to them? What do you want them telling the students about being a nurse practitioner?
Honestly, the same thing.
Okay.
Get
Okay.
some experience as a nurse before they jump right into becoming a nurse practitioner.
Okay.
And yeah, that really is, that's an important piece of this whole puzzle, is having some experience before you go get an advanced degree.
It really is.
Yeah.
It's very, very good advice. So typical career path. I'm a new nurse practitioner. I'm coming in and what is my typical path as a nurse practitioner?
So when you finish the nurse practitioner program, there's a great big exam that you have to pass in order to get a certification as a nurse practitioner. It's the national certification exam. So upon graduation, graduates go take that exam. Once they have that, they apply to the State Board of Nursing for their license to be an advanced practice registered nurse. And then it's simply a matter of finding the job that's the right fit with the people that you mesh with in the field that, in the office that you're the most interested in. Usually there's a period of time for I don't really want to say orientation, but there's a period of time for onboarding.
Mhm.
So a slower than typical patient schedule so that
Right.
the new nurse practitioner has time to get used to the electronic medical record and the flow of the office. So they have time to meet some of their colleagues, that sort of thing. And then after a couple of weeks, 6 weeks, they essentially are expected to function as a nurse practitioner. So it's
Mhm.
ramping up to a full schedule. And then it's the typically atypical day every day.
Awesome. And there's probably some, I imagine there's probably some mentorship in there as well from more senior nurse practitioners.
Ideally, absolutely. There are lots and lots of programs, like residency programs for NPs that have developed across the country over the last several years. It's something that people apply for. So they would get a more intensive year of onboarding where there would be some extra courses and extra mentorship. And that typically happens in specialty care like endocrinology or cardiology. So those programs are out there and available. It's just a matter of searching for them if that's something someone's interested in, and then that's an opportunity too.
Absolutely. Thanks for pointing that out. That's a very good distinction. So what are for a brand new nurse practitioner, what are the typical wages?
Depends on where you live,
Right.
depends on where you work. Most typically, what I have seen in the last 5 years or so in the state of Ohio is nurse practitioners that are right out of school as a new nurse practitioner, starting somewhere between 90 and 95 to $98,000 a year.
Mhm.
People that have some more experience or have been with the particular healthcare system for a while and transition out of a nurse practitioner program and then remain with that same healthcare system may get paid more.
Okay.
That's typical in primary care. So really somewhere between 90 and $105,000. It's a pretty wide range. It depends on which part of the state, really depends on which part of the country.
Yeah, that makes sense.
And then people who work in specialty areas, like I said, cardiology, nephrology, neurology, orthopedics, can make more than
Mhm.
someone in primary care.
That makes sense too. Um, okay. Thank you. Thank you for that. And I know I asked you a lot of questions. It was a fantastic conversation.
Thank you.
But is there something that I missed? Is there something else that you want to relay that we didn't get to talk about?
I can't really think of anything. Like I said, it's a really nursing in general is just a wonderful career path because it is so flexible and so varied. You can go from typical hospital nursing, 3 12-hour shifts a week to being a provider, which is, 8-hour days a week. Some people who are family nurse practitioners work in emergency departments and still maintain that 3 12-hour shifts a week. It just truly depends on what you want to do. You can be a nurse practitioner and teach in a nurse practitioner program. So there's so much variety. And medicine in general is ever changing and evolving. So there's always going to be something new and different and interesting that comes along. So someone who's in nursing, who's a nurse practitioner, who might be feeling a little restless, there's opportunity for something different.
Absolutely, especially with all the next new technology coming our way every single day.
Yep.
All righty. Well, thank you again. Thank you very much for your time today. We know you have limited time, so we really appreciate every minute. And we hope to be able to encourage some young students to become nurse practitioners in the future. So thank you for your time.
Thank you so much for having me.
Our pleasure. And thanks again to the Ohio College Tech Prep Organization for helping us to make these webinars happen for our students and teachers across Ohio.